One of the first and longest lasting impacts of the pandemic was felt within our medical systems. Healthcare was hit hard, and 5 years later, it's still dealing with the effects and uncertainty of that uncertainty and change. But many things have been learned as well. I spoke to experts in healthcare about what has changed since 2020. The one constant of early 2020,
I just remember how quick everything changed.
nothing stayed the same for long.
All the uncertainty.
Especially true for hospitals and healthcare workers.
There was just so many unknowns. It was very, very scary.
With few answers about the virus, sending people to the ER in
We
waves.
didn't have testing. We couldn't tell people what they had. We couldn't get people the help they needed.
There was a lot of fear in us coming to work. How are we going to take care of ourselves? Am I going to bring something home to my family?
Healthcare had to change.
So I think operations were tested very, very quickly.
Personal protection equipment was running low. Things like N95 masks were in high demand, and there often wasn't enough testing equipment.
I remember practicing on myself to swab myself on 3D printed swabs because we couldn't find swabs anywhere.
Healthcare providers started drive-through testing operations, and staff cross-trained in new jobs.
A lot of our nurses and our respiratory therapists in particular did a Herculean job of trying to learn on the fly new workflows.
Hospitals reached and exceeded capacity levels again and again.
It really hit our frontline workers hard.
5 years later,
When you do emergency preparedness, you take it a lot more seriously now.
healthcare has changed.
I think being nimble, that's probably the best thing that we've learned.
A big change has been the impact on the workforce.
Some of the more experienced nurses that were just, it burned them out. It was hard. And so we have a younger workforce.
A lot of the efforts that we focus on now are what are we doing for well-being? What are we doing for burnout?
Hospitals, public health, and more learned to work together in West Michigan. The large vaccine clinic at DeVos Place, an example of the cooperation. New innovations for patients and staff relied on technology to operate in unique ways.
One of the things that we found is that meeting patients where they are sometimes doesn't mean sitting in the same room with them. One of the most efficient ways to get to somebody is have them log into their phone, like we're on a Zoom call right now.
Unfortunately, another major change in healthcare was the opinion of the public.
There was a lot of uncertainty, and I think people were not used to healthcare not necessarily having the answers and not having the most clear-cut pathway.
Lessons in healthcare learned the hard way.
I think, we're here. We made it through it. Not all of us were that fortunate. We've all suffered loss, directly, indirectly. And we're still feeling the ramifications of the pandemic even several years later.
And another major impact on healthcare from the pandemic was a change in vaccine attitudes. There's a lot more to talk about with that, so we dive deeper into that topic during this special in about 10 minutes.